close the door and close this curtain. Hi, my name is Jenny. I'll be your student nurse today. We'll be performing a head-to-toe assessment, which should take about 20 to 25 minutes. Does that sound good to you?
Yes.
All right. Before we start, can you confirm your full name and your date of birth for me?
Jennifer LA, July 12, 2004.
Great. And then, do you know what today's date is?
July 23rd, 2026.
And can you tell me where we are?
We're in the nursing building in a study room.
And can you tell me what we're here today for?
Head-to-toe assessment.
All right, great. Okay, so I'm going to start with some hand hygiene. Okay. So during my general survey, I was able to observe that the patient is in no acute or respiratory distress. She is on room air, breathing unlabored and of even rate. She has no IV tubes, drains, dressings, or visible wounds. And her mood appears to be calm and cooperative, and she is alert and oriented ×4. Okay, and before we begin, are you in any pain today?
No.
Okay, on a scale of 0 to 10, with 10 being the worst pain that you've ever experienced, what would you rate your pain?
0.
Okay, great. All right, so first we're going to begin with a neurological assessment. So I will have you follow my pen light with your eyes without moving your head. Okay. Okay, great. Patients' cranial nerves 3, 4, and 3, 4, and 6 are intact with no nystagmus observed. Okay, and then I'm gonna have you close your eyes for me, please. Okay, I'm gonna place a cotton ball across your face. Tell me when you feel it.
Okay. I feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, great. Since patient was able to feel all sensations, her cranial nerve number 5 is intact. And then I'm gonna have you smile for me, and then puff up your cheeks, raise your eyebrows. Okay, since all facial movements were symmetrical, patient's cranial nerve number 7 was intact. For cranial nerve number 10, we would assess her gag reflex by placing a tongue depressor on her tongue, and if she has a present gag reflex, then it would be intact. For this assessment, we will not be doing that, but cranial nerve 10 is intact. Now I'm going to place my hands on your shoulders and shrug against my resistance. Great. And then I'll place my hand on your face and turn against my hand. Great. And this side. All right. Cranial nerve number 11 was intact. Her shoulders are symmetrical of equal height, and her muscle contour is also symmetrical. Okay, and then I'm gonna have you close your eyes for me again. I'm going to be placing a sharp and a dull sensation on your arms. First we'll start with a sharp.
Okay.
And then this is a dull.
Okay.
When I place it, just tell me what you feel.
Okay. Sharp. Dull. Dull. Sharp.
Okay. Patient was able to correctly identify all sensations. Therefore, her sensory receptors are intact. Okay, now we'll begin with a head inspection. So first, I'm gonna have you look down.
Okay.
I'm gonna inspect your scalp, and then I'm gonna go ahead and feel it. Okay. Patient's scalp was of appropriate color. It was clean. There was no pests or abnormalities observed. The color was of expected for her ethnicity, and it was non-tender and symmetrical on palpation. Now I'm going to assess your eyes. So I'm going to be shining a light in your eye. All right, right. 3, 2. Okay, and now I'm going to have you look at that whiteboard on that back wall.
Okay.
And then look at my finger. And then look at that back wall again. Okay. And then can you pull down your eyelids for me like that? Okay, great. Patient's pupils were, you can go ahead and stop. Patient's pupils were equal, round, reactive to light, and accommodation. Her conjunctiva was pink and moist. Her sclera was white and moist. Her irises are brown on both sides, and pupils are about 3 millimeters in diameter. Now I'm going to inspect your ears. So I'm going to go ahead and touch them. Okay, in this ear. Okay. Did you feel any tenderness?
No.
Ears are symmetric on both sides, colors expected, no abnormal findings, and no tenderness upon palpation. Facial characteristics are symmetrical, nose is midline. Now I'm gonna look at your lips. Perfect, and then can I have you open your mouth? Say ah. Alright, stick your tongue out. Lift your tongue. Okay. Patient's lips and oral mucosa were pink and moist. Tongue was midline and symmetric. Okay. And now I'm going to assess your lymph nodes. Okay, so I'll begin with the preauricular lymph node, and then the posterior auricular lymph node, and then the rest of them. Okay. Lymph nodes are non-palpable and non-tender. And then I'm going to assess your carotid pulses. So I'll start on this side. And then I'll do this side. Okay. Carotid pulses are 2+ strength and of even rate and rhythm. And then we're going to assess your neck range of motion. So I'll have you go like this, and then this way, and then look up, then down, and then to your left, and to your right. Okay, perfect. Patient's neck range of motion was full and muscle strength was 5+. Okay, and then now we'll move on to the upper extremities. So first I'm going to assess your skin. Is it okay if I go ahead and touch you for this?
Yes.
Okay. Patient's skin is warm and dry, of appropriate color, no abnormalities or lesions noted. And then I'm going to assess your turgor at your chest. Is it okay if I pinch right here?
Yeah.
Turgor is elastic as expected. Okay. And then we're going to assess your range of motion. So first I'm going to have you stick your arms out, and then flex them back up, and then push against my arms, and then against them again. Perfect. Range of motion at the elbow joints was full and muscle strength was 5+. And then I'm going to have you stick your hands out and squeeze my fingers. Perfect. Hand grip strength was 5+ as well. And then can you have your hands out for me again? I'm going to be assessing your capillary refill, so I'll be squeezing your fingers. Capillary refill was less than 2 seconds, and that indicates adequate perfusion. And then I'm going to have you take your 2 pointer fingers and have the nails lined up like that. Okay, perfect. No clubbing present. Nail angles are appropriate. Okay. You can go ahead and put your hands down. Okay, yeah. Now I'm going to check your brachial and radial pulses. Thank you. Okay. Brachial and radial pulses are 2+ strength. They are of equal rate and rhythm. All right, and now we'll move on to lower extremities. Is it okay if I lift up your pant leg?
Yeah.
Thank you. Okay, so first I'll assess the temperature. Okay. Legs appear to be warm and dry. They have intact skin. Hair is evenly distributed and have appropriate growth. And then I'm gonna have you remove your socks for me, please. I'll do some hand hygiene. So now I'll inspect the bony prominences to make sure that the skin is intact. So skin is intact at the knees, at the ankles, and at the heels. Now I'll be taking your pulses on your feet. So I'll begin with the posterior tibialis pulse. Okay. Strength is 2+, and rate and rhythm are equal. And then I'll do your dorsalis pedis one. Strength is 2+, and rate and rhythm are equal as well. And then I'm going to do the capillary refill on your toes as well. Capillary refill was less than 2 seconds, indicating an adequate perfusion again. Okay, now you can go ahead and put your socks back on if you'd like. And I will remove my gloves and perform hand hygiene again. And then next we'll be moving on to the chest portion of the assessment. So I'll begin by auscultating your heart sounds. Okay. So first I'm going to assess the aortic point, which is in the second intercostal space on the right sternal border. And then I'll move on to the pulmonic point, which is in the second intercostal space on the left sternal border. And then I'll move on to Erb's point, which is in the third intercostal space on the left sternal border. And then I'll move on to the tricuspid point, which is in the fourth intercostal space on the left sternal border. Okay, and lastly, we'll assess the mitral point, which is in the fifth intercostal space, left mid-clavicular line. And while I'm here, I'll be taking the apical pulse for 15 seconds, but it is normally assessed for 60 seconds. Okay, apical pulse was 88 and was of even rate and rhythm. All right, and then now I'll move on to the lung assessment. So first, I'm gonna have you hold your hands up like this, and then can you do one on your side? Great. So AP diameter is 1 to 2, which is of expected findings, and then chest wall also looks symmetrical. And then I'm gonna have you put your hands on your ribs where they meet and then kind of follow them down. Okay. Costal angle has a downward slope, which is of expected findings, and now we'll auscultate them as well, which means listen to them. Okay. So for each time I move my stethoscope, I would like you to take a deep breath in and out for me.
Okay.
All right. Okay. And then I'll have you turn around for me, please. And then I'm gonna move your hair out of the way. And then can you raise your arms for me? And then I'll go on this side. Okay. Great, you can turn back around for me, please. Oh wait, actually I'm gonna have you stay that way. I'm gonna test your thoracic wall expansion. So I'm gonna place my hands on your back. Okay, and then take a big breath for me. And then now you can turn back around. Okay. Breath sounds were clear with no adventitious sounds in the anterior or posterior auscultations, and thoracic expansion was symmetrical. Before we move on to the abdominal assessment, I'm going to assess your heart one more time to make sure that there are no murmurs. So just back up for me, please. You switch the bell of my stethoscope, and I'll listen to the same points that I listened to with the diaphragm. Okay. So S1 and S2 sounds were noted early, were heard earlier. No murmurs or S3 and S4 sounds were heard in the heart. Okay, and then now we'll move on to the abdominal assessment. So I'm going to have you lay down on the table. Thank you. Okay. I'll start by observing your console. Patient's abdomen has a flat contour and is symmetrical. Then we'll begin by auscultating. So I will move from the right lower quadrant to the right upper quadrant, to the left upper quadrant, to the left lower quadrant. Bowel sounds were no normoactive, no hyperactivity or lack of sounds were noted in all four quadrants. Okay, so now I'll be palpating your abdomen in the same pattern that I auscultated in. I'll start with light palpations and then I'll move on to deep palpations. Let me know if there's any tenderness that you feel while I'm doing this. I'll be palpating in a zigzag motion with circular motions upon each palpation. Okay, and now moving on to the deep palpations in the same motions. Yeah, you can go ahead and sit up. Patient's abdomen was soft and tender with no palpable masses and no... Oh, and then in a normal assessment, we would have her lift her shirt and I would observe for peristalsis, distension, or discoloration, and none of those appear to be present from what I'm able to observe here. Okay, so I'm gonna double check and make sure I got everything done. I believe that concludes our assessment. Do you have any questions for me?
No.
All right, so thank you for letting me assess you today. I'll be back shortly to check in on you, but I will see you again next time.
Okay.
I'm gonna perform my hand hygiene again. Open the curtain, close it, open the door, close it.